Hello, everyone. Greetings of the day to all the participants. Are you able to hear me?
Yes, sir.
Yeah. Fine. So my name is Dr. Pradeep Shinoy, and I'm one of the MRCP PACES mentors. So today we'll be discussing about the what is PACES, what are the steps of for the different stations in PACES, what are the common cases, how you can prepare, and how you can pass this exam in your first attempt. And more importantly, we'll discuss at the end of the session regarding the queries. So we'll begin with the what is PACES. So I think all of you must be knowing the full form of MRCP, that is a membership of Royal College of Physicians. So I tell my resident that most resident can pass probably easily this exam. It's a diploma degree in internal medicine, and it's not that difficult exam. So that should be the first thing we should be aware. And a few of your colleagues or seniors might have told it may be difficult, it's impossible, but do remember with your proper training, you'll be able to clear this exam quite easily. So this is the scheme, how you can get this membership. So you would have cleared either part 1 or part 2 written paper. Then subsequently, you'll be writing or giving the clinical examination, which is called PACES, which stands for Practical Assessment of Clinical Examination Skills. Now, who can apply for PACES? PACES can be applied by anyone who has cleared part 1 exam within the last 7 years, and it is going to test your clinical skills and communication skill. Now, how to pass this exam? So before passing any exam, you should know the rules of that exam. Okay? So if you know the rules very well, you can pass the exam. It's not your theoretical knowledge. It's not the number of patients you are seeing that is important. More important is how this exam is conducted and how you will be assessed by the examiner. So that's the main thing when you're going to prepare for the PACES exam. The PACES carousel, which is the different stations which we will be encountering in the exam, are as follows. So we have station one, which includes a respiratory station for about 10 minutes, abdominal station for about 10 minutes. Then we have 5 minutes interval, followed by a history station, which is about 20 minutes. Then there is again a 5 minutes interval, followed by station 3, which includes cardiovascular and neurology for about 10 minutes each. Then we have 5 minutes interval, and then we move into the station 4, which is a clinical communication skills and ethics. Then we have break about 5 minutes, and we will be entering into the station 5, which has 2 brief clinical concentration. So the total duration for this exam is about 125 minutes. And this is a quite tough task to be attentive during this 125 minutes. So this is the basic PACES carousel. And let us see how you are assessed in these exams. Now, these exams is conducted usually in a half a day. So either in the morning session or in the afternoon session. It's usually conducted in a hospital or sometimes in a clinical skills center. And you are assessed based on the 7 core skills. So these are the international centers which are available across the globe where you can give these PACES exam. Now, these are important. I'll tell you what is the importance of giving the exam in international centers. Now, if you've gone to these PACES carousel, you would have seen these 5 stations. Now, what are the stations with these stations are going to test? They're going to test your clinical skills. That is how you're going to examine the patient, how you're going to pick up the positive finding, how you're going to give a differential diagnosis, how you're going to manage the patients. Apart from that, they will also test communication skills. So how you're going to deal with the history, how you're going to deal with the difficult patient, or how you're going to deal with the patient where you need to break the bad news. Now, you might have seen hundreds of patients. You might have seen, might have come across these clinical scenario in your day-to-day practice. But what's more important is the presentation skills. Okay, so nowhere in the exam you will come across this skill. It will be mentioned in the PACES exam. Okay, so because whatever cases you are going to see, either your examination or you're going to do the history or the communication, you need to present it well to the examiner. Okay, please make note of this one. Presentation skills are equally important because you can have a very good clinical examination skill. You might have picked up all the positive finding, but when you present to the examiner, if you fumble or if you're looking, if you are going to speak without much confidence, the impression with the examiner will not be good. So remember, presentation skill will also be tested, which is not mentioned in the 7 skills. Now, what's the difference between your regular patient and this exam? This is because you have a time restriction. Now you need to demonstrate your clinical skill plus communication skill within a specified time. And this is the one which puts a lot of pressure on most of the students, because they will be having knowing the theoretical background, they will also knowing the diagnosis, but demonstrate everything within a specific time requires specific or special practice and has a different challenge. So remember, a PACES exam is not about your theoretical knowledge. It's not about undergraduate or postgraduate marks. So I've seen a lot of students who had excellent in their academics in the undergraduate and postgraduate exams and had difficulty in passing the PACES. I also seen students who are quite average in their academics, but cleared PACES in their first attempt. Okay, so just you need to know what are the expectations from the patient, from the examiner, and need to deliver these skills under pressure. So that's the only thing what matters. Now, this is the PACES carousel, which we have already discussed. So if you have any doubt during the discussion, you are always open. I'm always open to, you can ask any question. So I will be happy if it's a bit more interactive. So what are the skills which are being tested here? So the skills which are tested are physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patient concern, and maintaining patient welfare. These are the 7 skills which are tested in your examination. Now, we know that there are 5 stations, and each station, for example, station 1 has respiratory and abdominal station. So you're going to be assessed on 5 skills, and this is a clinical examination station. So you'll not be tested in clinical communication. You'll not be tested on the communication and the skill F. Sorry. The history station is going to test. You're going to test in the 5 core clinical skills, except the physical examination and the physical science. The station 3 is basically similar to the station 1. So is the communication station. In communication station, you're going to be assessed on 4 skills, except for the differential diagnosis. And station 5, you'll be tested on all 7 skills. Okay. So if you go through this list, you can see that station 5, you are being tested on all the 7 skills, and in each station you will have 2 examiners. So the maximum marks will be given in station 5, where each examiner will give you 14 marks. So that will be 7 into 2, it's a 14, and you have 2 examiners, so 28 marks per encounter. So this is the mark scheme, how you are going to give the marks. So marks, they will be allotted as per the standard reference. So you will be given as 0 if they find that your clinical skills or communication skills are unsatisfactory, or 1 for the borderline and 2 for the satisfactory. So the highest mark what you can get is a satisfactory, which is a 2 mark per skill. The lowest one what you can get is the 0, which is the unsatisfactory. Now, each examiner will review the patient before they are given to the participant or the students. So in each station, for example, station 1, 3, and 5, the patients may have different signs and different physical examination finding. So they'll identify 2 or 3 important positive findings, and they will grade that. And they will grade the student based on these skills. So it's very important. So for example, a patient may have for 5 or more physical signs, all of them may not be graded. Okay, so usually the hard clinical signs are graded, and few of the soft clinical signs may not be graded. So this is the encounter where you're going to have station 1 is 10 minutes each, station 2 is again 20 minutes, station 3 is 10 minutes each, and station 4 again is 20 minutes. Then we have the brief clinical consultation of 10 minutes each. Now we'll go a little more detail into the individual skill, because that is important. How examiner usually grades these skills. So first is the physical examination. Now physical examination means you need to demonstrate a very thorough clinical techniques. Now, whenever you examine any system, you need to start with the inspection, palpation, percussion, and auscultation. Okay. If you're going to do this in a methodical manner without any jumbling, then you will get a good score, or you get the maximum score. So do remember, physical examination is a skill which you should know before you enter the your exam hall, because this is a standard examination techniques. So you should have practiced so well that it should be subconsciously, you should be able to you'll be able to demonstrate these skills one after the another. Okay, it should never come into your mind that what is the next step I need to exam. So I finished the inspection, next what I have to do, I have to do palpation. So you should never get stuck in the examination techniques. So you should have done practice so that you can subconsciously do these, demonstrate these skills. So this here, it's not about physical finding, it's just about examination. So a maximum marks you can get is 2, and 2 from 2, both the examiner, it will be 4. Okay, so this is the skill which you can learn or do appropriately before even you give the exams. Now, identifying physical signs. Now here you need to identify the signs correctly. For example, if you have a patient with the bronchiectasis, you need to identify the clubbing, you need to identify the bilateral cords, crackles at the infrascapular area. Now these are physical signs, and there is no compromise here. Okay, these are hard physical signs. They are either there or they are not there. Okay, you cannot say say that there could be clubbing. You need to be very precise and very thorough with your answer that you have identified the physical signs. Now, what will happen if you are not identified the physical signs is that you will have a wrong diagnosis. Once you have a wrong diagnosis, subsequent skill will be marked either borderline or unsatisfactory. Okay, once you have the wrong diagnosis, you are not going to get a satisfactory mark in any of the skills which are assessed beyond your physical signs. Clinical communication. So this is encountered in the station 2, 4, and station 5. This is very important. So you should know how to communicate with the patients. Now, especially the international medical graduates, where clinical communication skills are not a routine part or not given that much importance in their undergraduate clinical undergraduate curriculum, these students might find it difficult. Okay? So those international medical graduate may need to give a bit more importance to clinical communication station, and you should know the proper structured, comprehensive, and you should be quite fluent in your English. So remember, some of the international medical graduate may practice in their native language in their own country. So a bit of advice, because in the PACES exam, you are expected to speak only in English. You may be giving your exam in your own country. You may be knowing the language of the patient, but you are not expected to talk in your own language unless there is an clear instruction from the examiner. Unless the examiner says do not speak in the local language, you have to speak only in English. In some situation, for example, when you are going to examine the central nervous system, it may take a bit more time. The patient may not know English, and sometimes the patient, you might need an interpreter in between. So that is going to take a bit more time, especially you're doing checking for the muscle tone, or you're going to check for the power and reflexes. So you need to take these additional timings when you're going to practice these for your exams. Differential diagnosis should be quite simple when you are going to give in a patient who are with the positive physical signs. So based on the physical signs, you are going to give a differential diagnosis. Do remember here, if the physical signs are not interpreted well, or if the physical signs are you are not picked up the positive physical signs, then you will have a wrong differential diagnosis. And once you have a wrong differential diagnosis, it's a downward trend in your score because you are going to get only borderline or unsatisfactory in the other skills. Clinical judgment is basically how you're going to plan the management of this patient, what investigation you would like to do. Now, there are situations where the investigation may be similar. For example, you have a cardiovascular disease patient. For example, there's a patient with aortic stenosis, which has got a systolic murmur, and you might have told that it's a mitral regurgitation because it also has got a systolic murmur. Now, the physical signs are different, and the clinical, the differential diagnosis or the diagnosis here is different. But the part of the investigation, because we know any cardiac patient will require a baseline electrocardiogram and echocardiogram and full blood count. So the part of the investigation may be quite similar. Okay? So you might get a borderline score if you because part of the investigation for the two diagnoses might overlap. So that's what you should know when you're going to assess on clinical judgment. Now, clinical judgment, as I mentioned, is it's important regarding the complete management of the patient. You should give importance to most of the time multidisciplinary management of the patient, looking into patient's overall status. Skill F, which is the managing patient concern. So concerns are very important, especially in the station 5 and station 2. So you need to be very open to the patient and discuss their risk factors, and would also you should be quite smooth when you talk verbally, and you should never you should never show your any abnormal behavior, or you should not cause any pain to the patient. You should be as gentle as possible. One of the ways what I tell students is to say at least thank you at least 3 or 4 times when you examine the patient. So whenever you examine the patient, you are changing a position. For example, you want to examine for splenomegaly, you want a right lateral position. So after the completion of the procedure, say thank you. Okay, so you need to appreciate the cooperativeness of the patient. So you should empathize with the patient. So be as gentle as possible. Another one, what you see is whenever doing a plantar reflex for a CNS case, so be as gentle as possible. Tell the patient that you will be, he or she may be having some discomfort while doing the test. So we know this, all the 7 skills will be judged in station 5. So do remember, if the clinical diagnosis or clinical judgment is wrong, you will have only a borderline marks from there on, because you will not be given a full satisfactory score because if the diagnosis is incorrect. That is called as linked skill marking. So if you go down on one of these skills, even other skills will be affected. But do remember, if your day made a wrong diagnosis in one of these stations, for example, CVS or CNS, you can still pass the exam. It is going to bring down your marks, but still you can pass the exam. So do not worry about it, if you have made a wrong diagnosis. Now this is the pass. What is the minimum requirement to pass the exam? So you need to get above 130 out of 172 to pass the exam. In addition, you need to pass individual skills. For example, in physical examination, you get 14 out of 24. So is the case with physical science. Clinical communication is about 10 out of 16. Differential diagnosis about 16 out of 28. And clinical judgment, you should get 18 out of 32. Patient concern is 10. You should get minimum of 10 out of 16. And welfare, usually you should get 28 out of 32. One of the common things what you observe immediately from this is that the maximum marks is given for the patient welfare. If you're going to score below 28 in one of the in patient welfare, you will not clear the exam despite your score is being above 130. So most of the international medical graduate, they usually lose the marks in clinical communications. So do remember to put an extra effort in clinical communication, especially if your undergraduate or postgraduate training had not given that much importance to clinical communication. Now we'll go into the individual stations for those who have already given the exam. It will be just a revision. We are just going to go into the important common cases and what are the pitfalls in each station. So if you have any question at this point, you can always ask me. So station one, what we're going to discuss is about the respiratory. So before you enter the station one, you will have 5 minutes. Okay. Now there could be two scenarios. One, you have starting with the station one. A second scenario is you have come from a station 5. So station 5 is a bit more intense because you are given 2 brief clinical consultation. So you might have not done well in one of the stations. So you may be a bit worried coming to station 1. Okay. So don't try to think about the previous station. I know it's very easy to tell, but difficult to execute. But still, maybe a minute or so, you can think about the previous station because it may be difficult for most of the students to totally neglect the previous experiences. So what we need to do in 5 minutes is that you need to visualize the examination steps. So what you know is that you are sure is that you have a respiratory patient inside and you need to examine the respiratory system. Okay. Now you have trained in last few months about how to examine the respiratory system. So do not make any mistake in the examination steps. That's a minimum what you can do. And you can give a good patient concern, like the welfare. You can look, you can take care of the patient without causing any undue pain. So these 2 skills, which are going to be fetching 8 marks, the 8 marks should be with you before even you enter the room, because if you know the physical examination steps and if you do reasonably well in patient's welfare, you should be able to get minimum of 8. Okay, so you can outside the room, you can just visualize. If you're getting disturbed by the surroundings, you can just close your eyes for 4 minutes, calm yourself, just visualize you trying to examine the respiratory patient. So that will give a bit more confidence, will also decrease your anxiety or nervousness. Now, when you respiratory system, what are the hard physical signs? Hard physical signs are usually clubbing, presence of any cyanosis, tracheal, the trachea central apex beat, and the auscultatory findings. That is that the patient is crepitation, wheeze, or a combination of them. So the most common cases which you encounter in station 1 are usually COPD, bronchiectasis, interstitial lung disease, pneumonectomy, lobectomy, pleural effusion, lung fibrosis. So do remember, do not use any of the short form in the exam. So COPD should be spelled as chronic obstructive pulmonary disease. And if you look at most of these cases, you'll find that most of the findings are usually in the posterior aspect of the chest. So the common the doubt what most of the students have is, can we start the examination from back? Yes, you can start the examination from the back, but do remember, do not skip any of the steps: inspection, palpation, percussion, and auscultation. Okay? It's not mandatory that you need to examine from front, followed by from the posterior aspect. You can always start from the posterior aspect of the chest as well. And what are the common mistakes while doing the respiratory system examination? The common mistakes are usually you're not able to identify the clubbing. You are not checked for the flaps. You have not checked for the apex beat, and unable to pick up the crepitations. And if you're going to hear some crepitation, do ask the patient to cough and check for any change in the quality of the crepitation, because that will give a different diagnosis if these signs are present. So these are the common mistake in the respiratory station. And once you finish in 6 minutes, next 4 minutes, you need to present to the examiner. Now, when you're going to present to the examiner, be confident. You need to practice this skill. You need to write down the physical findings and before the exam, and try to practice presenting to your colleagues or your partners, so that you are quite confident while giving your presentation. Okay, I've seen few students who are very good in physical examination and physical science, but when they present, they fumble. Okay, and that gives a bad impression to the examiner. The examiner says that this student or this doctor is not confident. He's not structured in his presentation. Okay, so you need to avoid such type of a presentation. So it's always better that there are only about 7 to 8 cases which are going to come in station 1 in either respiratory or abdomen. So you need to know the finding for each of the cases and practice presenting the skill, because unless you have a good presentation, this good presentation can partly cover if you have missed one of the softer signs as well. Station 2 abdomen, the common cases are chronic liver disease, hepatomegaly, splenomegaly, or a combination of hepatosplenomegaly. Then we have ascites, renal mass, renal transplant, multiple abdominal scars. So these are the few important cases which will get in abdomen station. Again, once you go inside, you need to finish this examination within 6 minutes and start presenting to the examiner. The common mistake is usually unable to identify, unable to do a flap, the liver flap. You're not checking for the jaundice, unable to identify liver mass or liver hepatomegaly or splenomegaly, and other one which is common is not performing the shifting dullness. So these are the common mistakes which the students do. So go try to examine methodically, inspection, palpation, percussion, auscultation, and then you present with a clear thought in your mind. History station. So you have 5 minutes outside. So you read the scenario at least twice and formulate the differential diagnosis and what are the relevant questions to be asked. So you'll be asking about history of presenting illness, past history, family history of the patient, personal history, social history, drug history, menstrual history, any systemic review, or any. In addition, you can always ask either the surrogate or the patient what are anything you have missed. Okay, so you can always ask the so have we missed anything while discussing about your condition. So you can always ask these question in between. Make sure that you listen to the patient, okay, and ask open questions. Okay, so examiner wants you to ask open question in the beginning. Okay, so do not ask specific question, and when you're going to ask the negative history, do not ask more than one symptom. So do not ask, do you have gained weight, lost weight, or do you have temperature, do you have observed high temperature. Do not ask more than one symptom. Okay, so be very clear, be very methodical. Just ask one symptom after the other. Okay, it may take a bit more time, but it will make sure that the examiner it will give the impression to the examiner that you are methodical in your structure when you're asking the questions. And always summarize the history, because in the history station you have about 14 minutes and 1 minute for the review and 5 minutes for the examiner. So you need to summarize before you conclude with the patient. Common mistake. So most of the time, most of the students, they take a lot of time in history of presenting illness. So by the time they come for the drug history, menstrual history, they would have finished 12 minutes. Once you cross 12 minutes and you are not able to summarize, you're not able to take systemic reviews, then you might be having less time to answer the patient concern. Okay, so at the end of 14 minutes, you are expected to explain the patient what is the diagnosis, what are the complications, what are the concerns regarding the diagnosis, and what they need to do. So do I need to refer them? Do I need to admit the patient? Do I need to send for certain investigation? So that should be clear to the patient. So patient concerns are quite important. So I would suggest, if you're not come to concern by the end of 12 minutes, you need to start immediately asking for concern and explaining the diagnosis. So a few things which are quite important in history station, which are missed usually, is you need to ask specifically about the pets. You need to ask specifically about the change in the drug dosage or recent change in medications. You need to ask about driving in a patient who's got a problem with the vision. So these are the few important specific questions depending on the case scenario. The common cases in this situation, what you can expect is a patient with abdominal pain, diarrhea, cough, chest pain, breathlessness, headache, history with back pain, falls, weakness of the legs, history of joint pains, or patient is being referred for abnormal liver function test. These are the common patients which you will encounter in the history station, and also patients with HIV. Station 3 is about cardiovascular system. Cardiovascular system, again, you have 5 minutes before you enter the room, and so you need to just visualize these steps of examination outside the room. Look for hard clinical signs. What are the hard clinical signs in cardiovascular system? These are the pulse, the JVP, apex beat, and a murmur. Because any diagnosis will depend on these 4 or 5 clinical signs. So do not miss these clinical signs. And the common cases are usually valvular heart diseases like mitral stenosis, regurgitation, aortic stenosis, aortic regurgitation, could be mixed valvular disease, or a patient with valve replacement, or rarely congenital heart disease such as ventricular septal defect. And the common mistakes here is few of the students are not quite confident about interpreting the raised JVP. Few of them are not confident about picking up the murmur. They are worried about identifying the murmur because they have not seen the adequate number of patients. So you need to practice these skills. You need to see a real patient where the JVP is really raised and the patient with normal JVP. If you're not able to go, if you're not had exposure to patient with valvular disease, do listen to these murmurs in the different channels. So in the YouTube or whatever resources you have, please try to listen to these murmurs repeatedly. That is very important, because then only you can pick the positive finding. Now, if you're international medical graduate, and if you're these cases with valvular heart disease are much more common in Southeast Asia. So if you're going to give exam in one of the Southeast Asian center, it's better that means you should have adequate exposure to this valvular heart disease. Suppose you're going to give exam in the UK, you may have predominantly a patient with aortic stenosis or patient with valve replacement. So it's better that you give exam in a country where you are trained, because you know these patients and you know what are the common diseases in that center. Moving on to the cranial nerve system, the CNS examination. CNS, most of the students just become blank as soon as they hear nervous system. They find it very difficult, but in the papers they are made much more simpler. So you need to examine either upper limb, lower limb, or cranial nerves. Rarely you may get a specific finding. For example, to examine only for the 7th nerve, or to examine this patient, the patient may be having a Parkinson's disease. That could be these specific instruction in such scenarios, but in examination of CNS, so you need to be very confident and you need to be very quick with the examination steps, because you have a lot of steps to cover. You need to look at the inspection, you need to look for the tone, power, reflex, coordination, and the sensation. So do not skip these patterns. So look for the tone, power, reflex, coordination, and sensation. Sensation may take a bit more time, so the 6 minutes may not be enough in these cases. So you need to be quite quick with these steps. Also, in addition, you need to consider the time required for the interpreter as well, because you will be the patient may not know English in certain countries, so you might find it difficult and it may take additional time. And additional thing, what we need to remember is that few of the patients might have paraplegia and they might have pain. Okay, so do not hurry with the examination. Just ask if they are in discomfort. So be gentle. If the patient has severe pain, you do not need to demonstrate that particular step of examination. If they feel that I have got pain, do not move that limb. Okay, so by causing him pain, you will lose marks in patient welfare. Okay, if the patient is not comfortable with one of the steps of examination, do not do that test, and you can move on to the subsequent examination steps. You need to just give a diagnosis based on the upper limb examination or lower limb examination. You are not expected to go beyond, but if you're able to come to a conclusion by examining one particular limb, then you can move on to the, for example, you have a patient with the paraparesis and you want to examine the upper limbs. If you have time, you can go ask the examiner's permission and then move into the upper limb examination. But the basic thing is, it's not about the diagnosis, it's about the picking up the physical signs in that particular area. Okay, so do not be in a hurry to examine the upper limb when your examination is given in the lower limb. Complete the lower limb examination, then if you have additional time, then only go for the upper limb examinations. Common cases, what you can get in the lower limb, we already discussed, is paraparesis, either spastic or you can have flaccid paraparesis. You can have hemiparesis. You can have peripheral, other cases like peripheral neuropathies, cranial nerve neuropathies, Parkinson's disease. You can have the cerebellar syndromes. You can have myopathies. So there could be various cases. Few of them cases may be a bit difficult. in terms of diagnosis, but the signs remain the same. You need to just follow the examination techniques. An additional thing, what we need to do is, please, when you're going to demonstrate a reflex, please hold the knee hammer the reflex hammer quite comfortably, okay? But the way you hold the hammer, the way you demonstrate the reflex, examiners will know that whether you have practiced enough or you have just come to the exam by watching some past test videos. So there are some students who just watch these past test videos and attend the exam. So unless you practice thoroughly, you will not be able to demonstrate these reflexes quite clearly, okay? So do practice the reflexes. As an examiner, they will be looking in keenly when you're going to check for reflexes, okay? Because the way you hold the knee hammer, the way you swing that hammer to elicit reflex, that is one of the important tools, how the examiner will make that, are you comfortable, are you good in clinical examination of the nervous system. Common mistakes is trying to wrong interpretation is the common mistakes. So unable to identify increased tone, not able to demonstrate the plantar reflexes, not able to complete the examination. For example, they are not able to complete the sensory examination. These are the common mistakes in the nervous system. But do remember, the more complex the case, CNS, it's easy to pass. Okay, somebody has come with some mitochondrial myopathy, with some external ophthalmoplegia. It is difficult for all the students. It's not only difficult for you, it's difficult for everyone. So more difficult the case, you just need to tell the positive finding. You are not expected to diagnose. It's quite, the examiner has a lower threshold to give you marks. Okay, so the more complex the CNS case, it's easy to pass. It is not difficult to pass. Station 4, communication skills and ethics. So this requires a bit of practice, especially for the international medical graduates, because these skills are not given importance in their curriculum. Here, you are expected to communicate with the patient and look for any legal issue or ethical issue. So before you enter the station, you have 5 minutes where you need to look into the scenario. So be careful, read the scenario at least twice. And the scenario, you need to know whom you are speaking. Are you speaking with the patient relative? And what is the main body of the main part of the scenario? Is it a breaking bad news? Are you negotiating a management plan? Is it a medical error? Are you asking for some consent for the procedure? And after looking into these parameters, you should identify the ethical issue and legal issue even before you enter the room. Okay, so as soon as you read the scenario, write down what are the ethical issue, what are the legal issue. The key to pass these skills, station 4, is to be a good listener. Okay, here the patient usually you have to give a lot of space to the patient. Do not interrupt the patient at any point in time. And if you want, you can give a pause at certain time. Okay, it's not only giving a silent pause during the breaking the bad news. For anything, whenever the patient is going to come up with the new information, you can always give a pause. Okay, that will support the surrogate to come out with the more and more information. Okay, sometimes what can happen is that there may be more than one legal issue. Okay, for example, you need to take consent, and there could be issue with confidentiality. Okay, so such scenarios, some of the hidden agenda may be there. So such information will come when you when you have the surrogate. Give more time to surrogate. Do not interrupt the surrogate at any point in time. So one of the example is that you may have for example, you may have a nurse who has come with hypoglycemia, and on probing further, you might find that this nurse is actually not diabetic, and she wants it's an episode of self-harm. Okay, so that will be reflected when you dig deep into the scenario. Okay, so you need to be very careful here. There could be more than one issues, either ethical or legal issue there. So you need to give a bit more time. The 14 minutes are more than enough for this station, provided you give a lot of time to the surrogate. Now, in some centers, surrogates are not trained well. So they may give a single response. They may not be, in such scenario, you might find it difficult to elicit a lot of the issues. So in such scenarios, only you need to ask for some close questions Otherwise, all the questions here should be open, and most of the centers, the surrogates are trained well. Station 5 is the crux of the or Achilles heel of the PACES, because here you have two patients who are assessed in all the 7 skills, and you'll be getting 28 marks each for the 2 stations, for the 2 encounters. So, and these, so before you enter the room, you'll have 5 minutes, and where we need to finish 2 cases. So you need to write them quickly. What is the scenario? So in 2.5 minutes, you need to write the differential diagnosis and the important question to be asked in BCC1 and next in the BCC2. The cases which commonly appear belong to endocrine, rheumatology, ophthalmology, or systemic diseases. Sometimes a patient may with some abdominal pain or transient ischemic attack may be kept in the exam if they do not have adequate, the center does not have adequate number of cases. So even nowadays, they give a simple case as fever, abdominal pain, cough. Even such cases are kept in station 5. But do remember that in this 10 minutes, you will have 8 minutes with the patient. So you need to demonstrate, ask for detailed history, focused examination, and then you need to ask the patient concern. Okay. Here again, you need to finish the history in 3 to 4 minutes, start examining the patient in detail, and ask for concern at least before 6 minutes, because you may require more than 1-2 minutes time to explain the diagnosis. Additionally, you can ask history in between while examining the patient. If you're going to come up with new symptoms or new signs while examining, you can immediately ask for the history. So it's the most important issue. So if you don't do well in station 5, it's unlikely that you will pass the exam. So be careful. You need to practice all the BCC stations. So it will give you much more confident. If your station 5 is very good, more likely that you will clear the exam. Even if one of these station is bad, still you can clear the exam. So common mistakes in station 5. So your few students take a lot of time to the history, so they do not have they do not have much time for examination and interpretation of signs and the patient concern. So what is expected is just do not spend a lot of time on the history, and always ask about drug history, social history, impact of the symptom on the job or occupation. That these are the vital parameter when you're going to assess on the history and the quality of life to that patient. So these are the few common mistakes for BCC1 and BCC2. Now, how to prepare for the PACES exam? So in the market, you have a lot of books which are available. So you can read any book which you are comfortable with. For station 1 and 3 and 5, the clinical station, we have Oxford text OST. For the station 3 and for the station 2 and 4, the rider book is also available. Then there are lots of books which are very good in certain sections. So you can discuss with your colleagues and or seniors who have given this exam, and then you can go, then you can read the book which you think you are comfortable. What about the videos? So there are, we have past test videos and other free videos are available in the website as well as in the YouTube. So you can watch those videos and try to get into the steps of examination by watching these videos. Okay, but do not go to the exam just watching the videos without any practice. It's 100% you are not going to clear the exam if you're going to go to the exam after watching only the videos. Courses, there are a number of physical courses which are available. So a small recommendation here is that you need to take the course in a country where you're going to give the exam. If you're going to give the exam in UK, try to attend the course in the UK. If you're going to give the exam in the Middle East or in the Southeast Asia, try to attend the center, the courses in that country. It's very important because the patient profile may be different in different stations, and the examiners may have different threshold to give the marks in different countries. So depending on the center, your case may be difficult. For example, one of the center may be quite popular for renal cases. Then in those patients, you might get a lot of renal mass or renal transplant. A few of the center may be doing a good number of liver transplant. Then you might get the liver patient. Okay, so you should know the centers where you're going to apply and be prepared for the common cases in those centers. Now, how to pass this exam, PACES exam? So first thing is know the rules. You should know what are the station, what are the expectation in these stations, how the examiner is going to judge you in these stations. That's the most important part. See the PACES exam cases. You may be a busy practitioner, you may be working in a multi-specialty hospital, you may be seeing hundreds of patients a day, but remember PACES cases are, PACES cases are like, we have each system about 8 to 10 cases. You need to see them. There's no point in seeing a case of pneumonia consolidation. There's no point in seeing some complex respiratory case without seeing the PACES exam case. Okay, so each patient you can practice with physical examination steps. Okay, but the PACES exam cases you need to see them before the exam, and that is the importance of going to the any physical course in the country where you're going to give the exam. And practice on patients. So you might be working in a clinic or in the hospital. So always practice on patient. One more suggestion here is always stick to the time. I know it may be difficult to keep the time, but when you practice on the patient, give importance to time. It is a time which determines your outcome in the exam. Okay, because anybody can examine RS, any undergraduate student can examine the RS with all the steps, but you are expected to do everything within 5 minutes to 6 minutes. Okay, so that is the skill here which you need to demonstrate. So when you always practice on patients, give equal importance to time because that is the one which will be tested. So stick to the time. Practice presentation skills. So this is one which is not highlighted in most of the during the training. So you need to present all the cases. So if you're going to go to the list all the PACES courses, for example, each station may having 7 to 8 cases. Okay, let us consider 10 cases also. So if you're going to go to station 1 and 4, 1 and 3, you'll have maximum of 40 cases. Okay, and maybe BCC you may be having 20 cases. So you should write down the positive finding of these patients and try to present to your colleague or your seniors so that you are confident of presenting. When you present, you should be quite confident, quite loud, and should express your finding in a sequential manner. Okay, for example, if you're going to present an RS case, it's better if you're going to start with the inspectory finding, then palpatory, then percussion, then auscultation. It gives a good impression to the examiner that you are quite structured in your presentation. And tips to the international medical graduate. So most of the time, what I see is most of the international medical graduate, they lack clinical communication skills. So you need to give a lot of importance to clinical communication, especially in station 2 and station 4. And please give your exam in the country where you're trained. It's the chances of passing the exam is much higher rather than giving the exam in the UK. So and also try to attend some courses before you give the exam, because that will make you more confident, because in the courses only you'll see the PACES exam, the PACES cases. Otherwise, seeing routine case will not add much benefit to your score in the PACES. So I think that's the end of my presentation here. I'll be very happy to take any questions from any of the participants. So let me check. Any questions from anyone?
Hello.
Hi.
Thank you so much for the presentation. I just wanted to ask about how to present the findings in the clinical station. Should I present only the positive findings or along with the important negatives?
Yeah.
Thank you.
Yes, welcome. So here, most of the examiner will differ in their judgment. Okay. So a few of the examiner will like telling the important negative signs as well. Okay. So I'll give you an example. Let us consider the case of bronchiectasis. Okay. So how I would present is, okay, so on examination of this gentleman, he is comfortable at rest, and on general physical examination, there is a clubbing without any cyanosis. On chest examination, the trachea appears to be central with the apex between the fifth intercostal space medial to mid-clavicular line, and the chest is bilaterally symmetrical, moves well with respiration. The percussion note is normal. There is bilateral chords, crackles at the infrascapular area, which do change with respiration. With these physical signs, I would like to give a diagnosis of bronchiectasis for this patient. So this is a simple presentation of a patient with bronchiectasis. So here I mentioned only the positive finding, clubbing, the inspectory and palpatory finding, the common negative history, negative signs, plus the most important is the crepitation. Okay, so do not give a lot of negative signs, do not give a lot of normal findings to the examiner, because it may make the examiner he may think that you may be wasting time here by presenting the case. So what the examiner thinks is that if you're not confident about the diagnosis, you need to discuss 4 minutes with the examiner. In such students who are not confident about the diagnosis, will take long time to present usually, because they're going to talk about inspection, palpation, percussion, auscultation. So if a student is quite confident about the case, he will just tell the important, he'll tell about only the positive finding and few important negative signs. And will not stop. You can, I would like to investigate this patient. You can go on presenting the case unless the examiner interrupts you. So additionally, telling the lot of negative things has got a drawback. So you may tell 1 or 2 important negative symptoms. For example, a patient with bronchiectasis, you may tell about cyanosis, because if the patient is cyanotic, he may require further evaluation with saturation and arterial blood gas analysis. So some physical signs, important negative physical signs can be expressed during presentation. Any other questions?
Yeah, I want to ask medical legal issues,
Yes.
we have to stick to the UK guidelines.
Yes. This exam is all about UK patients in the UK. So even you are giving the exam in international center, you are expected to express only the legal issue which are practiced in the UK. It's not about your individual country.
Many thanks.
Welcome. Any other questions? So we have an upcoming webinar by Dr. Intisar Malik. He's a very experienced PACES examiner, being PACES examiner for more than 10 years. And he'll be giving a live webinar in coming 4th November. So anybody of the participant interested, you can register for this webinar. So he's a well-known PACES examiner. So he'll be able to give a more important insight into the examiner, where how the students are assessed for the each stations. So any other question from anyone else?
For this webinar, how much will be the cost actually? This the upcoming webinar on 4th of November?
Yeah, I think we will share the details. You just keep in touch with the med expert. We will shortly give the details.
Okay, many thanks. Okay.
Welcome. Let me check any other. So is it necessary to start examination from hand always? It is good to always start the examination from the hand, but when you go to any station, first thing is you are going to look at the patient from the foot-end. Okay, you're going to observe for anything around the bed. Then you're going to, if in a respiratory station, you're going to ask the patient to cough, identify it's a dry cough or a wet cough, and then come to the hand. Okay, so it's always better that you start with the foot end of the patient and then come to the hands. Okay. Any other questions from anyone? So what is the best book to refer for station 2 and 4? I think it's the Rider, which is good for clinical communications. But whatever book you read, you need to practice. Communication skills require practice. So you need to practice with your colleague. That will that will add or that will improve your skills. Just reading the books is not sufficient to learn these communication skills. Would I get marks by mentioning the negative findings? You will not get, there is no marks for negative finding, but when you're going to present, for example, if I'm going to present a case of bronchiectasis, so what are the common DD? The common differential diagnosis will be interstitial lung disease, chronic obstructive pulmonary disease. So if it's an interstitial lung disease, you will find a classical fine end inspiratory Velcro-like crepitation. If it's a chronic obstructive pulmonary disease, you will find the V's. Okay, so these are the additional findings which will change the diagnosis. Okay, so it's very important that you tell the important physical signs which are particular into that patient. Okay, but mentioning cyanosis or mentioning about the JVP may be important when you're trying to assess the complication of that patient. For example, a patient with COPD may be having pulmonary hypertension. In that scenario, you need to mention whether JVP is raised or JVP is normal. A patient with COPD you need to tell whether the patient is cyanotic or not, because if the patient is cyanotic, then the entire management will change. You need to address the acute management of that patient. So it's very important that you mention one or two negative signs. But again, I've spoken to most of the examiner. There is no uniformity. Each examiner will look in different. They have their own views. All the physical signs has to be anyway told. The negative, few examiner wish that we tell the important negative signs. For example, clubbing, for example, cyanosis in a respiratory case. So I would recommend you to tell at least one or two negative signs if you're comfortable. Otherwise, just mention the positive signs. Let us take some more questions in the group. Okay. For station 5, is it necessary to exclude all important differential to pass, or only diagnosis is important? Okay. So as I mentioned, in station 5, all the 7 skills are assessed. One of the skills is differential diagnosis. So you need to have a diagnosis in mind, and you need to get at least 1 or 2 differential diagnoses based on the history. For example, somebody has come with a weight loss. You're going to give a diagnosis of hyperthyroidism. In addition, you can also consider other diagnoses of which can be considered weight loss. For example, type 1 diabetes. It could be pheochromocytoma. So these are the additional things. 1 or 2 differential diagnoses should be mentioned, because we have marks for that. For differential, there is an 2 + 2, 4 marks for the differential diagnosis. So you need to mention at least 1 or 2 differential diagnoses pertaining to that, relevant to that case. Okay, let me check. If anybody has any question, they can you can just unmute and you can ask. Let me go to a few other questions. In CVS or RS examination, especially a female patient, how to ask consent for examination, maintaining the dignity, privacy of the patient. Should we ask her to take out undergarments? Can we auscultate over the bra? Okay. So the thumb rule in PACES exam is not to auscultate over the clothes. Okay. If you're going to auscultate over the clothes, your physical examination score will be less, but do not auscultate over any clothes. Second thing, what I have seen is most of the patients, female patients, where we kept is mostly for the cardiovascular patients, for the cardiovascular system, and you have a nurse who is right beside the patient. Okay, and they will usually tell the lady to expose adequately. If you think that the lady is being not exposed adequately, you can ask the examiner that I would like to have adequate exposure. And if the examiner says that it's not required, we can continue with the present status, then in such a scenario, you may continue with the examination. Otherwise, you need to ask the examiner that you need more exposure. And once the permission of examiner is obtained, then you can proceed with the examination. So usually, if you have a female patient, a nurse will always be available along with the patient, and you can always ask for adequate exposure. So a lot of doctors find difficulty in ophthalmoscopy. Any tips for that? Okay. So first, you get hold of ophthalmoscope. Just feel for how its ophthalmoscope is that. Okay. Second, you watch the video of the examination of the ophthalmological examination. there are only two things what you know. The first thing is you examine from the distance, look for the red reflex, then you come closer to the patient and look for the optic nerve head and then the retinal vessels. Okay, so you need to practice this skill. This skill will not come by watching video. Okay, you need to demonstrate your skills. So you need to get hold of your ophthalmology colleague if you have, or get an ophthalmoscope. Try to use the ophthalmoscope and try to follow the exact procedure. Okay, so you need to have at least training in ophthalmoscopy. Okay, so watch the video, then try to do it yourself. If you do about 10 or 20, 15 times, you'll be able to demonstrate these ophthalmoscopy skills. Okay, it's very important that in station 5, usually you have a patient with headache or patient with visual problems. You need to see a fundus. So previously, most of the station, what they in most of the examiners used to just skip this ophthalmoscopy. They used to tell that, okay, not required. You just ask for fundoscopy, they said not required. Okay, now last 1 year I seen patients, the examiners insisting on ophthalmoscopy. Okay, so so it's very important that you should know ophthalmoscopy before going into the PACES exam. You may not know the findings, but at least demonstrate how to examine these steps. Okay. Any question, any other question? So any tips regarding preparation time? Preparation, at least I think 3 to 6 months time is required depending on your training background. Resources, you need to look into the books and videos which I already started. Exam center, so choose the center where you're trained, if you're the nearest center where you're trained, because you'll be knowing the patient, and go to the course which is available in that country. Do not, if you're international medical graduate, better to take from your own country rather than coming to the UK. It's difficult to get the seat for the PACES. Yeah, because of the COVID outbreak, I think there have been a lot of drawback, and there are no easy way to get into the waiting list here. One thing is you can write a message to them that you have applied thrice and you're not got the slot. Okay, so you can write a message that may work. Otherwise, it's on the waiting list, and those who have, like, we need to clear this exam within 7 years. So you can go. So within 7 years, we're going to cross that 7 years gap will be given priority over the person who are going to apply for the first time. So any course in India, so you can go to the I think website, and you can check, go to the Google search, and you can look for the individual countries which courses are good. Sometimes you do not understand the accent of a patient in station 4 and 2. Can we ask them to speak loudly and slowly? So you can request them that if you're not able to understand, you can say, pardon me, and you can ask them. Of course, you can request them. But try to follow them as much as possible. Do not interrupt them. You can always request them if you're not able to understand the accent of the patient. Okay, this is the one reason which I strongly recommend, that you need to give the exam in the country where you're trained, or the neighboring country, nearest exam center, because the accent may be difficult in different countries. So it may be a bit difficult if you're going to give the exam in the UK if you're not trained in the UK. But anyway, there are courses which you can get a training, and then you can give the exam. Any other question? Will they provide the translator? Yes, they will provide translator, because you're not expected to speak in any other language other than English. Okay, you need to speak only in English. So you may be a local candidate, you may be knowing the local language, but do not speak in the local language. The patient may be having difficulty understanding English, so it has to go to the translator, and it creates a problem in CNS examination. You're going to ask for the power, especially power, move up and down. Look for the power. You need to tell in English. It has to be translated to to the patient. So sometimes it's easy that you do it yourself. You ask them, demonstrate that you do this movement or that movement. Okay, that becomes more easier if you're short on time, rather than telling the translator and then into the to the patient. So do do consider this additional time. If you're a translator, it's going to take at least 30 to 40 seconds in addition to the normal time of examination. Any other question from anyone else?
Hello, doctor.
Yeah,
We
hello.
ask about alcohol. If patient has liver cirrhosis, then we advise him to stop alcohol or to modernize his intake and other liver diseases. What the question we ask him about alcohol?
Yeah,
And
so
our
first thing, yes. So first thing, when you have a patient with alcohol and you have liver disease, first thing is explain the patient that alcohol is bad. It is adverse. It is going to cause liver disease. Okay. So you tell him that we have de-addiction services as well, so you can refer him there. So always ask the patient, first make aware that alcohol is the cause for the liver disease. That is educating the patients. Once you educate the patient, what is the further management? So you need to stop alcohol, isn't it, to control, because otherwise just decreasing may not be sufficient if the patient already has a chronic liver disease. Okay, so you need to refer him to a de-addiction center or de-addiction clinic and encourage the patient to stop alcohol rather than modernizing alcohol if already he has a chronic liver disease.
Here, if the cause non-alcoholic fatty liver, in this scenario, what we can advise the patient?
In station 2 or
Station 5, the cause not alcohol, it is a non-alcoholic fatty liver.
okay, if it's non-alcoholic fatty liver disease, so they'll be advising the treatment as per the non-alcoholic fatty liver disease. So you're going to ask about, inform him about the lifestyle changes, controlling any the chronic diseases like diabetes or the hypercholesterolemia. So it's just about general management. If you think that the patient is not alcoholic, you're not going to advise him to stop alcohol. It doesn't make any sense. So you're going to talk about a lifestyle and few drugs which are available to tackle these chronic diseases. Any other question? So if there are no other questions, we'll end this webinar here. So I'd like to thank everyone for participating in this webinar. Have a great day.
Thank you very much.
Welcome.